Valve surgery. Many cardiac valve problems can require cardiac surgery. One or more of the heart's valves doesn't open completely. When one of the heart's valves doesn't open completely, blood cannot circulate freely. Therefore, the heart must work harder to move blood from one chamber to another. In medical jargon, this is called valvular stenosis. One or more of the heart's valves doesn't close completely. On the other hand, when one or more valves doesn't close completely, blood can seep back into the chamber it came from. This is called valvular incompetence. These two valve anomalies may cause various symptoms, including dizziness or loss of consciousness, shortness of breath, chest pains, and swelling of the ankles and abdomen or weight gain. In general, to re-establish proper valve function and relieve symptoms, doctors will recommend surgically repairing or replacing the valve. If the valve cannot be repaired, it will be replaced by a biological or mechanical valve. Biological valves are made of organic tissues. They don't make any noise, but their durability varies. Mechanical valves are made of synthetic materials. Their main characteristic is that they are long-lasting, but they make a ticking sound. Moreover, patients who receive a mechanical valve must take blood thinners, such as Coumadin, for the rest of their lives. The surgeon will speak to you about which valve is most appropriate for you. The final decision is yours. The operation's main steps. General anesthetic. Before putting you under, you'll be hooked up to a cardiac monitor, a device that measures arterial pressure, a pulse oximeter, which measures the oxygen levels in your blood, and intravenous fluids. Then you'll be put under anesthetic. This stops you from feeling pain during the operation. Once you are anesthetized, you will be intubated to help you breathe, and a urinary catheter and some venous access lines will be inserted. The anesthesiologist will monitor you throughout the operation. Opening the sternum, or sternotomy. Most of the time, a sternotomy is performed. This technique consists of cutting your sternum in two, vertically, and spreading the two halves with the ribs. This approach gives the surgeon access to your heart. Temporarily stopping the heart, cardiopulmonary bypass. Your heart will be temporarily stopped and connected to a heart-lung machine. This device consists of a pump that does the work of your heart and lungs. Repairing the valve. Once the surgeon has access to your heart, they will repair the defective valve. Replacing the valve. The surgeon will remove the affected valve, replacing it with a new valve, a biological or mechanical. Once the valve has been repaired or replaced, your heart will be restarted. Closing the sternum. At the end of the operation, the two sides of your sternum will be put back in their normal position and attached with steel wires.